Pregnancy complications, part 1, anemia in pregnancy. What causes anemia in pregnancy? When are you considered to be anemic? And what are signs and symptoms of anemia in pregnancy? And lastly, what are the complications of anemia in pregnancy to you and your unborn baby, or rather after giving birth? Welcome back to the Nursing Moms. I'm Nurse Janet, and in this video here today, I want to talk about anemia in pregnancy. During pregnancy, the blood volume increases and there is a need to make more blood. This means that you must be having either enough or more than enough iron, the folate, all the requirements to make the blood. If you didn't have it enough, then this is where the anemia will be setting in. Actually, the already available one will be used, and if you are not either reciprocating the used one or you literally didn't have enough from the start, then this is where the anemia will set in due to the increased blood volume. There are 3 types of anemia that occur during pregnancy. We have the iron deficiency anemia, that is a lack of enough iron to make blood. We have the folate deficiency anemia and vitamin B12 deficiency anemia. All these are required to make the whole blood. So if there is any deficiency, then most likely whichever the one that you are suffering from will land you to that type of anemia. What are the signs and symptoms of anemia in pregnancy? Okay, anemia itself is a condition where there is not enough red blood cells to carry oxygen to other parts of the body. Remember, it's the red blood cell that will be carrying the oxygen either to your brain, whichever the function that the body takes, it has to get some oxygen to facilitate it. So in anemia, there is not enough red blood cells to carry this oxygen to other parts of the body. These are some of the signs and symptoms that you will be feeling according to the condition. Number 1 is dizziness. Definitely, if the brain is not receiving enough oxygen, the first sign will be feeling a bit dizzy. The second one, you'll be feeling weak and fatigued. Yeah, you are always tired, doing light activities and you are tired. Another one is paleness. This one will be checked on the skin, the nails, or even the lips. Yeah. And another important one is rapid heartbeat. Yeah, what we call palpitations too. And another one, you realize that if you are anemic, you have trouble in concentration or even short memory. Yeah, this is for the obvious reason that the brain is not receiving enough oxygen, and brain is the center of everything. And this one is mostly common with iron deficiency anemia. Yeah, hii kukula mchanga, hii ya kukula mawe. Actually, it's not something that you should take lightly. It's an indication that there is lack of iron in your body. You are not getting enough iron. Yeah, and that is why you are either eating makaa or even eating hii mawe mara sijui inanunuliwa. It is not your fault. It is your body that is demanding. Who is at risk of getting anemia in pregnancy? The first one is if you are pregnant with multiple pregnancy, that is more than one baby, either twins or triplets or any other number. And this is for the obvious reason that your body will need more blood to sustain the 2 growing babies inside you. Yeah. So your body needs to make more. If you didn't have enough iron, folate, or even vitamin B12 in store to make this blood, then most likely you'll end up anemic. Yeah. 2 close-up pregnancies, yeah. And this is why you really need to let your body rest. Suppose you were pregnant and like in the 3 months later, you are already pregnant after delivery, then most likely you can be anemic. And if you were previously anemic, this too can land you to be anemic in pregnancy. Yeah. If your HB or the blood levels was previously low before the conception, then after conception too, most likely you will end up being anemic. Poor nutrition during pregnancy. Yeah, during pregnancy you really need to eat well. You can check on the previous video that I did about some of the best foods that will give you the required nutrients during pregnancy, and especially these nutrients that are required to make more blood. So you really need to focus on the nutritional part for you to avoid being anemic in pregnancy. If you are not taking the supplements, those are the folates, the folic acid, the vitamins, yeah, these two can lead you to be anemic in pregnancy, and this is why it's always very advisable to take those iron supplements being given during your antenatal clinic visits. And some of the complications of anemia in pregnancy includes preterm labor. Yeah, the baby can come much earlier than the expected date of delivery. The baby can be born with low birth weight. The baby can also be born anemic, and you as a mother, you are at risk of bleeding either during delivery or even post-delivery. You are also at risk of getting infections. Management of anemia in pregnancy. For you to manage anemia in pregnancy, you have to know the category, whether it's mild, moderate, or even severe. The normal hemoglobin level during pregnancy should be between 11 to 13.5 grams per deciliter of blood. And again, we have the mild anemia, we have the moderate, and we have the severe anemia. With severity, you will need transfusion. But these other ones, you can be put on iron supplements and work on your diet. I'd already shared some of the very most important foods that if you take will improve your blood level. This will help with intake of nutrients like the folate, the vitamin B12, or even the iron. All these kind of foods are there. And again, while eating, if you're getting the iron-rich diets, then you really need to work on the vitamin C too to help in the absorption of these kind of foods. And this is why it's quite important that those tablets that you always get from the clinic, yeah, those ones that you are always given while you go for your antenatal clinic visits, the iron tablets, the folates, the vitamin B12 tablets are very important because they have a task to keep your body in making more blood, and more blood is equally needed during pregnancy. Thank you for watching. I hope someone found this video educative, interesting, and of great help. Bye. Let's meet in my next video.